Hello everyone, welcome to part 3 of NEET PG November 2025 recall questions. So, question with the neonate with obstructive jaundice, HID, Hyder scan was done, and what is the next management? This is direct from the notes. The general tests will be done, mostly LFTs will be done to check the status. If the direct and indirect bilirubin is decreasing or not, or what is the status of the ALP. So these tests will be done once the HIDA scan is done. Then crocodile skin, that image was given, that is seen in that two options are confusing, in which both of you have marked that arsenic poisoning and electrical burns, but the answer is electrical burns and not arsenic poisoning. Now, laryngeal carcinoma fixed when spread inside that thyroid cartilage. If thyroid cartilage is given in the question, answer is T3, and that is in the TNM staging. If thyroid cartilage they have mentioned, that is the correct answer. Then STI kits in men is not for, it is not for genital discharges. It is for urethral discharge and lower abdominal pain, but not for the genital discharges. Then management of eclampsia. Next step will be the balloon. What they have asked, what was the next step? Balloon tamponade was the answer for that. Then McNaughton rule in schizophrenia. That is one correct answer we have to mark. That correct answer is they are not liable to crime. That was the correct answer. Then which causes extension at hip and knee? So hamstrings they will be causing, that is the correct answer. That image was in more options. If you can recollect, that will be better, and we can discuss it later also. Then HAART, this is a repeat question from last NEET PG exam. That is the repeat question. I have recalled it that time also. So ATT, that is followed by ART after 2 weeks. This is the correct answer for HAART. Then DPP4 inhibitor and ketoconazole. So dose adjustment is needed in for which drug? That is not for sitagliptin, not for vildagliptin. That is needed for saxagliptin. That is the correct answer. Then dose response curve with the ACH, which drug is involved? Though bethanechol is the drug that is involved with ACH in dose response curve. That is the correct answer. Then a hanging case with pupil dilated and lot of secretions are present. What is the real cause for that? So sympathetic chain compression, this is the correct cause for hanging with pupillary dilation and lot of secretions. Now, a tricky question, not a side effect of beta blockers in asthma. So hyperkalemia is the correct answer because it is not a side effect of beta blockers. Then what is the hallmark for Conn syndrome? So options were hypernatremia, alkalosis, and hypokalemia and hypertension. Okay, so what are the symptoms we will see? Frequent urination, increased thirst, weakness, headache, muscle cramps, tingling, all these, hypertension, palpitations. These all are the symptoms, but hallmark, what you will mark? So hallmark, the correct answer will be hypertension. That is the correct answer, not hypernatremia. What people have marked, not hypokalemia, not alkalosis. Hypertension is the correct, that is combined with hypokalemia with that, but the most is common hallmark is hypertension. Then the more fluid imbalance is seen in, this is colostomy was given, ileostomy was given. See, I will tell you. Electrolytes imbalance will be more in ileostomy, and if more proximal jejunostomy, it will be seen in colostomy. Fluid imbalance will be more. So that is the correct answer. Then Prader-Willi syndrome, that is deletion of 15p11 is 13. That is the correct. That was the question. That is a little doubtful question. Can you recall that all the options, please? And p-value 0.03 is given, so it is significant. Till 0.05 it is significant. So if the p-value is 0.03, it is called significant. Then Peutz-Jeghers syndrome, it is a STK11, multiple polyps are seen, and it is autosomal dominant, not autosomal recessive. This was given, so you have to mark this. This is the correct info for Peutz-Jeghers syndrome. Now, child closed inside a washroom, and cherry red spots were seen so on the body. So what will be the correct cause for that? See, carbon monoxide poisoning. Then seen in G6PD deficiency of this is the fasting hypoglycemia is seen in G6PD deficiency most commonly. And germ tube image was given, if you can remember. That is the most commonly asked image. It was of people were confused on candida and nectar of hookworm, but the correct answer is candida. So stay tuned, and if you can recall more options, please do comment below, and more questions we will discuss it in the next part that is coming soon. So please stay tuned.